Hi, my name is Meredith Childers. I'm going to be doing a presentation on multiple sclerosis. All right, we're going to do a quick introduction, location in the brain, signs and symptoms, and some therapeutic strategies. All right, multiple sclerosis is an immune-mediated chronic disease of the central nervous system that affects individuals in their early adult life. And it can have drastic consequences on functional, emotional, and financial course of the patient's life. The disorder is characterized by intermittent, recurrent, and focal episodes of inflammatory demyelination and transection of central nervous system axons, which leads to the development of progressive neurological disabilities. There are 4 types of MS. There is clinically isolated syndrome, which is typically the first one that is when the first symptoms start happening. They last at least 24 hours, but it is not able to be diagnosed quite yet with the characteristics. Relapsing remitting is the most common one. And a lot of times when the relapsing remitting MS, they will transition into the secondary progressive form of MS. And then there is also the primary progressive MS. Those are the 4 types. All right, so what is multiple sclerosis? There are 2 main types of important immune cells, the T cells and the B cells. So T cells become activated in the lymph system, and in MS enter the central nervous system through blood vessels. Once in the central nervous system, T cells release chemicals that cause inflammation and damage. This results in damage to myelin, nerve fibers, and the cells that make myelin. T cells are also important to help activate B cells and call on other immune system cells to participate in the immune attack. T cells dampen or turn off inflammation. So in MS, T cells do not function correctly and they do not effectively turn off inflammation. Cytotoxic or killer T cells directly attack and destroy those cells bearing certain characteristics. B cells become activated with the help of T cells. B cells produce antibodies and stimulate other proteins, and in MS, these cause damage in the central nervous system. And I've also provided 2 visuals that just show what a healthy normal nerve looks like, and then what a nerve looks like with someone with multiple sclerosis. All right, this slide just kind of goes over where in the brain you will find the lesions of MS. So lesions are typically going to be found in the gray and white matter of the brain and the spinal cord. And then it's also going to be, MS is also referred to plaques that form in the central nervous system with inflammation, demyelination, axonal injury, and axonal loss. Those plaques are found in the brain and spinal cord around usually white and gray matter, and found in the ventricles, optic nerve, and tracts, corpus callosum, cerebellar pendicles, long tracts, and subpial region of the spinal cord and brain stem. And this shows some images of MRIs, and you can see these white spots where this would be someone diagnosed with MS. And then I will show a quick video that also shows some different images of the brain with an MRI.
Dark and low signal, but if there's a white matter lesion on these, it really stands out as bright. So this is an arrow pointing to a white matter lesion. Here on the left side, it's in the back left. Here's the front, and here's the left, here's the front right, just to get oriented. Now if we go down to the bottom Things look very good down below here. Here's the brainstem, cerebellum, and if you're going up, there may be a tiny lesion here on the left-hand side, very, very subtle. And if we keep on going up here, we're going to look really carefully at the periventricular white matter, or the pericolossal white matter. Again, the corpus callosum is that band that joins the right and left cerebral hemispheres. This is it in front. And on the front right side, there's an arrow pointing to a lesion. So this is right next to the right corpus callosum towards the front. Is sort of a characteristic location for MS. So,
all right, I'm going to go ahead and pause that video. We're going to go on to our next
just to
slide.
get a confidence that this may be.
All right, so who does MS affect? So typically MS is going to affect people kind of starting in the ages of 20 to 40 years old. It will a lot of times start, first symptoms usually in the late 20s or early 30s. Women are 3 times as likely than men to get MS. It does affect all nationalities, although it is most common in Caucasian of Northern European ancestry. Now we're going to go on to signs and symptoms. All right, so some common symptoms of MS is going to be numbness or tingling in the face, arms, or legs. MS hug, which is squeezing sensation in the torso area. Fatigue, walking difficulties, spasticity, weakness, vision problems, vertigo and or dizziness, bladder problems, sexual problems, cognitive changes, emotional changes, tremors, breathing problems, and hearing loss. So those are all just some, and everybody's going to be different, what symptoms that they are going to occur. Diagnosing MS is going to be completed by a neurologist. They are going to get a medical history on the patient. They will take an MRI. They will do a spinal fluid analysis. They will take blood tests just to rule out any other diseases or conditions. And then a neurological exam will be completed, which consists of testing of cranial nerves, sensation, reflexes, coordination, and walking and balance. All right, here's a video of 4 people that are living with MS.
My current routine looks nothing like my routine before diagnosis.
Every day is different.
When I woke up today, mentally I felt really good.
My morning with MS is unpredictable. I think about MS pretty much from the moment I wake up till the moment I go to sleep.
I don't usually have an alarm set. I usually like to sleep in and let my body get the rest that I need. Fatigue is a pretty heavy symptom of MS.
Physically, I did wake up with some muscle spasms, so I did have to use my massager.
Today is a very quiet symptom day. My body never lets me forget that I have MS.
The second the doctor says you're going to have a lifelong chronic progressive condition, it's hard to turn that down no matter what's going on. It flavors everything.
Even if my symptoms are quiet, it's just those little tingles. It just feels like it's reminding me.
When I set routines, it makes me feel like I am in control of my multiple sclerosis.
All right, I'm going to go ahead and stop that video, and we're going to move on to the next slide. Some common problems with MS regarding speech. So some common symptoms will be scanning speech, which is when you don't have or you lose the melody while you're talking. Dysarthria, which is slurring speech. Dysphagia, difficulty swallowing. Dysphonia, loss of volume, and that a lot of times is due to just fatigue. You're weak, and so your diaphragm just is weak, and so you lose the volume of your voice. Stuttering, and then also nasal speech. So someone might sound real nasally. All right, some therapeutic strategies. The first set of strategies are more specifically speech and language. And an SOP is going to focus on exercises to help strengthen the muscles of the tongue, lips, cheek, and mouth. Strategies to help slow down speech and increase articulation. Breath control. Assistive devices such as amplifiers, visuals, AAC devices, or there are plenty of apps on, a phone or tablet that you can use. An SLP is going to help with strategies for making swallowing easier, such as body and head positioning, changes in type of food or their consistency. And then also they're going to work on language if there's any cognitive problems. Some other therapeutic strategies, there's FDA approved drugs that are focusing on helping reducing relapse, delaying the progression, and managing symptoms. Rehabilitation programs that focus on functioning and safety at home and work. And then you're also going to work with other professionals such as occupational therapists, helping with everyday activities. Physical therapists are going to help with, walking if you're having any difficulties. Neurologists, audiologists if you have any hearing loss, and psychologists. And this is just someone that can help with any emotional changes, or depression is something that a lot of times people with MS will get, and a psychologist can help with that. All right, this is a video diagnosed, or the woman is diagnosed with MS, and she speaks about difficulties with swallowing.
Hello, I'm Marlo Donato Love, and I have multiple sclerosis. Speech and swallowing. I have had problems with both, not just like slurring and being tongue-tied. I did start to have problems at one point drinking. I used to have trouble drinking things that were things that would normally slide down your throat, like water. I would always gag and choke. When I first started choking, I realized when I was at work, because I would just be talking to people and just like at the water cooler and having a drink and gagging, and people started saying to me, "God, are you okay?" And then I realized, I think I'm not okay. Every time I drank water, I would gag, and I could not swallow it. And that was really scary. What I try to do actually, in fact, if I'm drinking, because water still I can gag on, sometimes when I'm drinking it, if I just tilt my neck down, believe it or not, slightly, it's easier. I think, the drinking in public, even just drinking socially, even drinking champagne, which is my preferred drink of all, even that, like just being out socially, and having to think, okay.
Stop that video. All right, these are all my references. And I just want to add also, as of today, there are no cures for MS. Researchers are searching and doing all kinds of research to help find cures and just further treatments to help. But seeing, different professionals that will help provide different strategies and treatments, and taking the medications to help with the symptoms of MS. And hopefully one day they'll find a cure. And that is my presentation. Thank you.